I'll always remember this, is that, because it all happened in the course of like 1 week. I had 3 different patients where it was like the exact same thing. And I was looking at, they had this chart of how their marker, the tumor marker, was changing over time. And they had data for years. And it would plateau, and then it would go up. And then it would plateau, and it would go up. And it was just kind of this gradual progression, which is what you tend to see with this disease, particularly when patients are not being treated with chemotherapy at that time. And I asked them, well, what happened at that point where you saw that spike went up? And it was like, oh, my father died. And then we go to the next one, and it's like, oh, my best friend was diagnosed with cancer. And it was very...
It's a simulation of that trauma.
Yeah, it was just such a predictable connection between that emotional stress and the direct progression of their disease. And when it was pointed out to them, it was just unreal. They couldn't believe how strong that connection was. But the point is that this stress, it affects the immune system in a very detectable way. And it makes sense that if you have any kind of emotional trauma, it will affect how your body fights this disease.